Hello, you're welcome. Welcome to the practice questions, standard first aid and CPR AED level C course practice questions. So these are just practice questions. They are like mock exam, mock test, okay, and the objective is for you to use it to prepare for the main exam and also to test how much you have learned so far. Okay, so use it as a yardstick to test how much you have learned so far. Okay, you don't have to worry if you didn't get it. Okay, we're going to have opportunity to review, especially if you are enrolled in the course and you are coming for the training. Okay, so take a piece of paper, put your answers, and then bring it. We'll be able to review these things in the class. Okay, all right, so let us go. If you are ready, get your pen, get your paper, and let us see question number 1. Here we go. Question 1. It is unethical to assume that every patient is potentially infectious. Is it true? Is it false? So you need to choose the letter that match. So if it is true, you put A in front of question 1 on the piece of paper. If it is B, which is false, then you indicate the letter that matches your choice. Okay? Do you think it is unethical to assume that every patient is potentially infectious? Okay, so let's go to question number 2. Question 2. A child patient is a person who, A is under 1 year, B is 0 to 10 months, C has not reached puberty but older than 12 months, D just reached puberty. So a child patient is a person who. So again, choose the option that you think is correct. Okay, so let's go to question number 3. Which of these are the right first aid for shock, emergency shock? So which of these are the right first aid for shock, emergency? A, give the patient a shock medication. B, give the patient water to drink. C, maintain the patient's temperature. D, call 911. So which of these are the right first aid? Okay, so if there are multiple, you need to indicate multiple. If it is 1, just indicate 1 choice. All right, which of these are the right first aid for somebody in shock? A, give the patient a shock medication. B, give the patient water to drink. C, maintain the patient's temperature. C, call 911. Okay, so let's go to question number 4. Here we go. Since survey activities do not include, since survey activities do not include A. Safety checks, B. Assessing patient for life-threatening conditions, C. Taking necessary protection measures, D. Obtaining permission or consent. So which of these does not include scene survey activities, or is not part of scene survey activities? So which of these options is not what you do or should not be part of what you do when you conduct a scene survey? All right, so let's go to question number 5. Heart attack and cardiac arrest are the same. Heart attack and cardiac arrest are the same. A. True. B. False. C. Nearly true. D. 75% false. So heart attack and cardiac arrest are the same. What do you think? Let's go to next question, number 6. The law that protects first aiders from liabilities is called, the law that protects first aiders from liabilities is called Good First Aid and CPR Law, Excellent Samaritan Law, Good Samaritan Constitution, D. Good Samaritan Law. Okay, so choose, and then we move to question 7. When performing CPR, what should you remember? A. To push hard and tough. B. The rate of compression, I think that should be the rate of compression, is 90 to 120 per minute. The rate of compression is 90 to 120 per minute. To compress between 100 to 120 in 60 seconds. To compress between 100 to 120 in 60 seconds. D. Allow the chest to recoil 90% between compressions. So when you perform CPR, what should you remember? What should you remember? Okay, so put your answer and then let us move to question 8. Provide first aid in the position the patient was found. Provide first aid in the position the patient was found. True or false? So what position should you consider first? So provide first aid in the position the patient was found. True or false? So question 9 is next. Which of the following about rice is wrong? Okay. A. Rest. B. Ice. C. Compression. And D. Elevation. Okay. So which of these is wrong, or which of those are wrong? So R-I-C-E. Okay, so rest, eyes, compression, elevation. Question 10. Which of the following positions can a patient be put in when you perform CPR? Which of the following positions can a patient be put in when you perform first aid? supine position, squatting position, tripod position found. Which of the following positions can a patient, so you see positions, so there could be one or more correct answers here. So which of the following positions can a patient be put in? Supine, squatting, tripod, position found. Okay, question, okay, that should be 11, I think. Let's see. Okay, yes, I think there's a repeat. So this should be question 11. So severe blood loss is a risk factor for. Severe blood loss is a risk factor for A. Anaphylactic shock, B. Hypoglycemic shock, C. Hypovolemic shock, D. Electric shock. So severe blood loss is a risk factor for which of these shocks? So choose. Alright, next question. Assessing patient for non-life-threatening injuries is done during A. Ongoing patient care, B. Secondary survey, C. Scene survey, D. Primary survey. So assessing patient for non-life-threatening injuries is done at what stage of emergency scene management? So you choose the one that is the right one, and then we move to question 12 or 13. Okay, which of these are the stopping conditions for CPR? Which of these are the stopping conditions for CPR? A. Patient becomes exhausted. B. Safety is no longer granted. C. First aider starts breathing normally. D. EMS arrives and takes over. Which of these are the stopping conditions? So which ones do you think are the stopping conditions for CPR? All right, the next one, an environmental related emergency where the patient's temperature is dangerously high is called what? Hypothermia, exothermia, heat exhaustion, heat stroke. So which one is correct? And let's move to next. Giving sugary drink to an unconscious hypoglycemic patient is proper first aid action. Giving sugary drink to an unconscious hypoglycemic patient is proper first aid action. A. I agree. B. I disagree. C. It depends. So choose the letter that matches your choice. Next question. Based on the HSF Manual 2015, the emergency scene management includes some of these sequences except scene survey, scene tracking, primary survey, secondary survey. So there's exception here. One is wrong. Which one? All right, next question. Which of these is not a legitimate first aid activity? Legitimate first aid activity. A. Checking the scene for safety. B. Putting on gloves where necessary. C. Administering medication. D. Calling the EMS number. So which one is not? Okay, next question. Which position is recommended for a patient who is unconscious but breathing normally and circulation appears normal? A. Squatting position. B. Semi-sitting position. C, recovery position, D, tripod position. Which position is recommended for a patient who is unconscious but breathing normally and circulation appears normal? Next question. CPR is performed in cycles of chest compressions and breath. A cycle of CPR consists of 25 chest compressions followed by 2 breaths, 30 chest compressions followed by 3 breaths, 100 to 120 chest compressions followed by 2 breaths, 30 chest compressions followed by 2 breaths. A cycle of CPR consists of what? So indicate your answer. Next question. Which of these is a controllable risk factor for cardiovascular disease? Which of these is a controllable risk factor for cardiovascular disease? A, age. B, stress. C, ethnicity. D, family history. Which one is controllable risk factor? Next question. Which of these can cause shock? Which of these can cause shock? A, heart attack. B, severe blood loss. C, severe allergic reaction. D, all the above. Which of these can cause shock? Anaphylactic shock is due to severe allergic reaction. The signs and symptoms of this condition or this reaction include diarrhea, breathing difficulties, respiratory or cardiac arrest, or the above. Anaphylactic shock is due to severe allergic reaction. The signs and symptoms of this reaction include, so which one is correct? And we move to next. Angina is to the heart attack what TIA is to the stroke. A, false. B, true. C, 50% true and 50% false. D, all the above. Angina is to the heart attack what TIA is to the stroke. So choose your answer. Next question. JJ appears to be having stroke. What do you expect to see when assessing him? A, speech difficulty. B, face drooping. C, A and B. D, only A is correct. Next question. What is the right first aid for JJ who is confirmed to be experiencing stroke? What is the right first aid? A, put him in tripod position. B, give him aspirin. C, call 911 immediately. D, spend a bit of time to assess him more. Okay. What is the most appropriate first aid for this person who is confirmed to be experiencing stroke? Alright, so we move to next. Sample is a guide for knowing the medical history of a patient. Sample. What do A and L stand for in sample? A, anemia and last meal. B, allergy and last time seeing a doctor. So I read that again. B, allergy and last time seeing a doctor. C, anti-allergy and last meal. D, allergy and last meal. So A in sample, L in sample. What do those two letters stand for in sample? So again, choose and choose. And so yeah, I think that is the end of the practice question. Please watch out for more practice questions. Okay, watch out this space for more practice question, and please subscribe and like the video. If you have not done so, please subscribe and like. Thank you so much. Thank you, and see you again. Bye.